So you will find out if my ovaries are normal?
Yeah.
Oh, okay.
Just kind of where you're starting out before we stimulate you.
Okay. So you can basically tell me like how much stims I need.
The doctor's going to review everything when we're done.
Oh, okay.
He'll review all that, and then we'll call you in the afternoon, this afternoon. Okay.
Okay.
Let you know, confirm your start dose and all that good stuff.
Okay.
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 Any other questions?
That's it.
Okay. Go ahead and lay back whenever you're ready. You know if you get uncomfortable, okay? Doing all right?
Uh-huh.
Okay.
I'm pushing it out.
You're okay. So that right there is your uterus. And the first thing we like to look at is your lining. Retroverted solid lining.
Is that good or bad?
We just look at the thickness of the lining today. So what happens today is I'm going to have you get a blood draw before you leave.
Okay.
Check your estrogen, make sure it's low.
Okay. So is that good lining or?
It's a little thick.
Oh, okay.
What'll happen is once you quit the birth control pills, you'll probably have a bleed, and that's what's supposed to happen, and then it'll thin out that lining. So that's.
Okay.
So I'm going to have you scoot your left leg out. Perfect. And we're going to take a look at your right ovary. You doing okay?
Yeah.
Okay, so this is your right ovary. Right 10. No cysts in the right ovary. And then those tiny little black dots are antral follicles that we like to look at.
Okay. Oh wow. What are those?
That's your bowel.
Oh.
You doing okay?
Yeah.
Okay, perfect. So now we're going to take a look at your left ovary here. Which is right here. 520. No cysts on left ovary. All right. You okay?
Yeah. A bit uncomfortable, but it's okay.
Yeah. So let's come out and get a blood draw.
Okay.
Okay? We'll make sure that that's low, and I'll have you touch base with the nurse today.
Okay.
All right, perfect.
So is everything good?
Everything's good.
Okay.
So one of us will call this afternoon and confirm that yes, everything's fine, and we're going to follow the calendar as planned.
Okay.
And so we're assuming that probably the estrogen will be low, and you'll be able to follow it. So I'll go over it.
Is it because I'm in birth control that my lining is thick?
No, it's just you haven't bled quite enough yet for your
Oh.
lining to be thin enough as to like we know for sure that
Yeah.
everything's okay.
Mhm.
So we don't take any chances.
Okay.
I will call you this afternoon to confirm, but probably tomorrow will be the last day of the birth control pills. After you stop the pills, you usually can get a period within a few days after,
Yeah.
and that will also help thin the lining.
Yeah.
So no matter what, that's going to happen.
Yeah.
And then most likely we'll tell you, go ahead and start your medications as planned on Saturday. The Brevel 300 total units a night. So I think that's 6 vials. No, 4 vials.
Is that what my original dosage was before? Or did you increase it?
I think it's been 300 from what you got in your emails with Liz.
Okay.
And so that should be 4 total vials, the Brevel, a night to get the total dose of 300.
So 4, okay.
And then the Menopur, you'll do 75 units at night. This is just 1 vial of the Menopur, and these can be combined if you wanted to, so all into one injection. Okay. It does help when you mix them to let them, like, you'll mix them together with the fluid and then let them sit for maybe 15 minutes, like on
really?
a counter. Yeah, otherwise they tend to sting, like when you do the injection.
Okay, so let it sit for. Okay.
Yeah, it's not going to harm anything. It's really
Can
for
I
your
make
comfort.
Can I
yeah,
make a note?
of course.
Let's sit.
And it's really, if you injected it right away, it wouldn't harm anything. It's just you might notice it like stings more than normal. So.
And that's because it hasn't fully mixed.
It's the
just,
Menopur.
I don't know why it happens, but yeah, it just, we found out that patients who let it sit out for 10-15 minutes, they didn't have as much stinging. So I don't know exactly the chemical reason.
It hasn't been dissolved.
Maybe.
Completely. There's
Maybe
chunks
it's still
of
like
powder
fuzzy
in there.
or something.
I agree.
Yeah.
I think that's
It works. It just is fine. It's just
Okay.
for you.
Okay.
So you're going to continue doing these injections until we say otherwise. So you'll still be doing the Brevel 300 units, the Menopur 75 units every night until we say otherwise.
Okay.
On these appointments, so all these yellow days,
I have to come in for blood work.
yep, blood work only on this day, and then this is blood work and ultrasounds on day 5 and 8. Have you scheduled these yet, or
No.
we can do that next with
Yeah,
finance?
and this one to the 7 weeks, the IVF follow-up.
Okay,
appointment.
yeah, we can do that on the way out.
Okay.
So after each of these appointments, you can always expect us to call you and let you know what to do next.
Are you open Saturdays?
Yep,
Okay.
open every day.
Okay.
So for
Okay.
things that are time sensitive like this, we're open.
Okay.
We'll call you after each of these and let you know what to do until we see you again, what to do until we see you again. This starts talking about the Cetrotide medication, and at some point we'll let you know when to start using it. It'll be your 3rd injection or your 3rd medication that you're going to do in the mornings. Most people start it the morning after this day 5 appointment, but we will let you know officially when to use it after we see you.
Okay.
Some people start it that day, some people start it even
The
later
next
in the
day.
cycle.
Okay.
We just want you to know that it's going to be starting sometime around here.
Okay.
And then after the day 8 blood work and ultrasound, you're starting to get close to the egg retrieval. So egg retrieval, as you can see, there's a chance of egg retrieval, and this is the 50% day, the most common day we expect people to come in. Most people come in on day 8, and we say they need a couple more appointments, so more blood draws and ultrasounds until they're ready for their egg retrieval. If you're ready this day, the earliest your egg retrieval could happen is this first day. Most people need more time, so that's why egg retrieval can happen later on.
Okay.
And we'll go over everything you need to do for egg retrieval when you're close to it. So just be ready. Egg retrieval can happen this week. Hopefully you guys are both already in town.
Yeah, we'll make sure.
Okay. The 50% day, we kind of pretend as if this is the day for the rest of the things marked on the calendar. So the day you have egg retrieval, you'll take pain medication to recover from surgery. And then it looks like we're preparing for embryo transfer. And so the next day, you'll start taking some other medications. We'll remind you about it when we get closer. If egg retrieval happens here,
What does this mean? I have to take this vaginally?
it'll be inserted vaginally.
Okay.
And so there's basically an estrogen tablet and a progesterone tablet that you'll insert with your finger or with an applicator if it comes with one,
Okay.
just like a tampon.
Okay.
That usually starts a day or two after egg retrieval, depending on how we move forward. If egg retrieval happens this day, it's considered day 0, so embryos are 0 days old. And then they're 1 day old, 2 days old, 3 days old. So that's why it says possible day 3 transfer. 4 days old, 5 days old. So possible day 5 transfer. If your egg retrieval happened later, these transfer dates would move out later potentially, or if earlier, they would move back earlier.
Okay.
And then 2 weeks after egg retrieval is when we do the pregnancy test to see if you're pregnant. So these dates are still flexible right now, but just so you understand why they're mapped
It's
out
not
like
like
this.
a month from now. Okay.
Now on the grade A, is that when I do my specimen sample also?
On
same
the
as-
gray days, yes.
the
So the
same
same
day?
day she has egg retrieval, but the same
Okay.
day we want the sample because a fresh sample is the best.
Okay.
So we don't
And you-
want to use a frozen sample if we don't have to.
And you want me to go ahead and withhold for, is it 2 or 4 days?
It's so
2
we
to
say
5.
2 to 3 days
Okay.
ahead of time. I kind of say after day 8 to all my patients because usually you're gonna have that timeline between them.
Okay,
but
so
from
like,
day 8 on.
five days, and okay, that's fine.
Yeah. It just depends on how fast you're going, but the earliest she could be ready is probably this day. So if egg retrieval happened 2 days later, you're still covered.
All right.
And he need to take Zithromax when?
Any day you can get it. Has it been called into a local pharmacy or did it come with your medications
They're
already?
gonna come up with my medication and it won't arrive till the 17th.
Okay, just take it that day.
Okay.
Okay.
Yeah.
And is it just a 1-day antibiotics that I take?
Yep.
Or okay.
You'll take all 4 tablets at once.
Okay.
It's kind of nice to take them at night before you go to bed so you can kind of sleep through them if they give you any like stomach issues.
Okay.
But just all at once, and then you're covered technically for 6 months by our standards.
Okay.
So.
what is the antibiotics? What is it?
It clears out the sperm sample of any potential added bacteria.
Okay.
So when we're mixing the sperm and eggs, there's just no extra bacteria that might harm the embryo once we have it in culture.
Okay.
So that's what we're trying to prevent. And like I said, for our purposes, once you take it, you're covered for 6 months of samples. If you had to do another cycle, if you were planning to do another cycle, who knows? If there was some random family emergency, just so you know, you just have to take it now.
And do you know when I'm supposed to get my estrogen result? What time?
It'll be back by this afternoon. And we'll call you today about the blood draw that you did. But it'll be back today.
So I should be like getting like a heavy flow on the 17th, you think?
Maybe. Some people, they get it right away. Some people, it comes later at the beginning of their cycle.
Is
It
that
just
because
depends.
of the birth control?
The birth control pill's stopping. Yep,
Okay.
exactly. Once the pills stop, usually people get a bleed shortly after. But it might take a little bit longer. It might come right away. It just depends.
Yeah. Okay.
So we'll call this afternoon to confirm that yes, we're gonna follow that plan, and if there's anything else we need to do or watch for.
Is it gonna be a heavy flow, do you think?
It depends, and because your lining's a little thick right now, I'd expect it to be like a period. So
a period.
probably I don't know how to compare it to other cycles you've had.
Yeah.
But it's like a period.
I'm just worried because my regular period they start really like light, and then towards like 3rd, 4th day it becomes really heavy. So
Heavy?
is it gonna be like that?
Probably, yeah.
Okay.
It might start off heavy and then get light, but essentially you can expect to be bleeding. And when you see that bleeding, don't worry that it's messing up your cycle. It's what we want your cycle to do.
Yeah. Okay.
So that's what we really want you to know.
Okay.
Any other questions?
No, that's it.
Okay.
So I just need to schedule all these.
Yep, schedule these 3 and then the 7-week, and then we'll stop by finance.
Okay.
All right?
Okay.
Thank you so much.
Yeah, of course, guys.
Let's go.
And so all of your monitoring appointments will have to be in the morning so that we can get same day results and keep you
Okay.
on schedule.
Okay. And the blood works for estrogen?
Yes, you got it.
I'll do 9.
Okay. You got it. Just be on the
Just to
safe
make
side.
sure, yeah.
You got it.
So I just need blood work.
Yeah, and it'll be like a 10-minute appointment.
Okay. So maybe you can just wait outside.
Yeah, that's fine. I mean, if all they're doing is taking out your blood, yeah, that's
Yeah.
fine. I don't even have to videotape that.
Yeah.
The next one is on the 23rd, so that one will be ultrasound and lines. And so we have plenty of time available for that one as well. So it looks like first available is 8 a.m. or the latest we have is a 9:45.
9:30 ultrasound and blood work.
Either way, she's gonna be like 10 minutes late.
Gotcha.
Is it just blood work only?
That one will be blood work and ultrasound on that one as well. Yeah. And the latest we have for that one is a 9:45 or anything
Yeah,
prior to
9:45.
that. 9:45?
Yeah.
Okay.
So 9:45.
You've broken your
Oh,
mouse.
cheese and crackers.
I thought I was the only one that says that.
Oh, come on. All right. Hopefully I have another fire here. Yes, I do. Okay.
You're ruining my shot.
I know. I'm so sorry. All right. Let's try this again. Oh, all right.
It's alive.
Good grief. All right. So 9:45 it is. 3, 4, 5, 6. So it'll be roughly about the last week of October-ish.
Last week of October.
Yeah.
Then
Yeah.
so 1 o'clock.
You wanna do 1 o'clock?
Here, right? In
Yes.
Seattle. Okay.
Yeah.
Is it gonna be like a long appointment?
Roughly about a half hour.
Okay.
Yeah. Hopefully we can change it because you'll be doing your OB ultrasound.
Am I? Hopefully.
Yeah.
Hopefully.
Exactly.
Oh.
That's the intention.
Mhm.
Perfect. So you are all scheduled.
Oh, cool.
And then of course, so when you're doing your appointments, then Shannon will update you. She'll give you a call that day, like later in the afternoon, just to say, okay, you're good to go for day 5, or if we need to add another, blood draw day in there somewhere, but you'll get updates each day. Yeah,
Okay.
on what's going on. So perfect. Did you guys have any other questions or anything else you want to go over?
No, that's it.
Alrighty, perfect.
Thank you so
do you
much.
need this back?
Sure.
Okay.
Thanks so
Thank
much.
you.
Have a great
Thank you
morning,
so
you guys.
much.
You're
You
very
too.
welcome.